Welcome back to the African Emergency Room. Do you have low back pain? Do you know anybody that has low back pain? Has it been a concern to you? That's our topic today, and Dr. Fosa has been doing very well with telling us about low back pain and what may be causing it. Before we quickly look at the treatment and prevention of low back pain, Dr. Fosa, are there other causes?
Yes, thank you, Dr. Alex. There are other causes of low back pain. The degenerative spine disease, occurring in most of the time, or majorly in the elderly patient, middle-aged and elderly patients, could cause low back pain. They could come down with symptoms of low back pain. And even degenerative disc disease, the intervertebral disc, disease involving the intervertebral disc could lead to low back pain. And in malignancies, patients, for example, males that have prostate cancer.
By malignancy, okay, you mean cancer?
Cancer.
That's what
in cancer, cancer of the breast in females or males, or prostate cancer in males, it can have what we call metastasis spread. This can also lead to low back pain because the bone is now diseased and being they'll call eating up of the bone. Let me put it in a layman's way, and this can cause low back pain. There are other congenital causes, that's conditions that the patient was born with. Maybe a patient born with an abnormal curvature of the spine, what we call scoliosis. This can also lead to low back pain. Others are acquired, especially as I said earlier, posturing causes low back pain.
So which means when we come to treatment, it will be important that somebody will not see, this person had low back pain and they prescribe this drug for him. Now that I have it, let me just take that drug. What is causing your own might be different from what is causing somebody else's own.
Exactly.
I need to. Okay, so how do we treat these people with low back pain?
Now, the treatment of, or management generally of people with low back pain, it's individualized. You won't say because this one had low back pain, as we just said, that's the same way I want to treat this other person with low back pain. And this management starts from the history. You want to know the cause of the low back pain. How did it happen? Was for example, in the case of trauma, trauma from what kind of source, or where is this pain? Does this pain radiate down the lower limb, or is just localized to the lower back? I want to know that. I want to know the progress of this pain and the possible complications. Now, having known the history, the patient has to be examined properly. And examining such a patient, want the examination start from even general examination, as you know, because it may give you a pointer to what is the cause of the patient. That patient having low back pain may even have anemia. So general examination is first of all important. And the patient who has malignancy, that's cancer, will have other symptoms, other things. So you examine the patient properly. Now you examine specifically the back. And of course, examination starts from how you inspect. You want to see whether there's any swelling on the back. You want to see whether there's the normal posture of the patient's back. Then from there, you want to also do what we call palpation. You now use your hand to feel, to know what exactly is happening to the patient. Then you also do your range of motion. Can this patient bend over? Can he bend to the side? You want to know the range of motion, is that angle to which the patient can bend compared to the normal that he should have. Then, having done all this examination, the patient would require investigations. At the point of history taking and at the point of examination, your diagnosis will you'll be already having your diagnosis and differentials, but you want to confirm your diagnosis, know the extent of this condition, and also prepare the patient for possible treatment as the case may be. Such a patient who has a low back pain must first of all know that his low back pain will not be the same that happened to his father or his colleague. So it's important, so paramount important that this patient should first of all complain to a doctor. He should go to hospital. It's not a time to say, I want to go to my grandfather, let me find out what he did in his own case. Go to a doctor because your own case may be different from the other person's case. The doctor will now take the history, how it occurred, examine the patient, and request for those radiological investigations and other investigations, because other causes, there are different causes of low back pain, as we earlier mentioned. Yes. Having done all these, the patient can be treated based on what has been found, and this treatment can be non-operative or operative. The non-operative means you are using medical treatment or you are using just physiotherapy. While the operative, the person has to go under it's a surgical procedure to alleviate the pain. For the medical aspect of the non-operative, the patient is placed on, give the patient NSAIDs, normal painkillers, so that the patient can the pains can be relieved,
Yes.
and go back to his normal activities. Such a patient could also have physiotherapy done, also a non-operative exercise of the back, guided exercises.
Guided. They may just go to the gym and somebody will break what is.
He worsens the situation.
Yes.
So physiotherapy is also another means of non-operative treatment. It's a patient that is now not getting better, is not responding to non-operative treatment. Maybe there's persistent pain, the pain is lasting beyond what would they expect,
Yes.
or maybe there's now neurological deficits. What I mean is the patient is now having progressive paralysis of the lower limb. Such a patient might benefit from surgical intervention, because the prolapsed disc, as the case may be, or may be impinging on the nerve, and it's not slipping back. And if you remember that, when I said non-operative, some of them can have maybe bed rest, just 3 days bed rest, 2 to 3 days bed rest can suffice in some cases. While in some cases they could stay 3 weeks and with traction of the lower limb, with them the traction of the lower limb, and after being there in bed for some time, and the disc can slip back. It depends on the different presentation in different individuals.
Okay. Thank you so much, Dr. Fosa. There was a patient we admitted. He was brought into the emergency with severe low back pain. He was not able to stand and walk. And because I had this before, and when I heard that Novartis Pharmaceuticals was going to sponsor a training in Ghana, and I saw that low back pain was included, I quickly went for that training to learn how to manage low back pain. So I had to talk to this guy. I told him I had this before, this is it. And we admitted him and treated and all that. When he was getting better, I heard him, he didn't know I could understand his language. I heard him telling his family members that these people that wanted to do this thing to him, if they had gotten him the way they planned, that he would have been paralyzed. But that, as God will have it, they did not really succeed. And I felt like after everything I explained to this young man, we still felt like some people wanted to get him. Thank you so much for doing justice to this, to let people know that it's not anybody doing this to you. People who are very agile, who move around, and they get so surprised when all of a sudden, hold me. How come I can't move? I can't. It's so painful. Hold me. Somebody must be responsible for this. Nobody is. But we're quickly going to look at the prevention, especially on this postural aspect. How to lift. I may crave your indulgence to see a few demonstrations on how to lift correctly, because that's really, a lot of people go about lifting. Lifting is part of our lives, and it's good for us to learn the right way to lift, to prevent low back pain, or to prevent it worsening when we already have it. So how can we prevent low back pain as we round off?
Thank you, Dr. Alex. Preventing low back pain could be simple, just like from normal posturing and avoiding other predisposing factors. You see a young man wanting to walk, maybe he wants to impress his peers, he carries his bag on one side, bends over and is swaying. The lumbar aspect of the bone is swinging up and down.
Yeah.
It gets to a stage, his ligaments are not as strong as in the younger age group. By the time he's getting older, and he could have pain from such posture, or even sleeping on the disc.
I used to walk like Stone Cold. Remember Stone Cold? Try to walk like that. All right.
Then our patients should avoid activities that could lead to trauma to the back, right, to the lower back. Then smoking. The use disease from smoking. It goes a long way to affect our body tissues and make the lower back ligaments and more to make them pliable and cause slip disc. Then again, obesity. We should cut down on things that will lead to obesity.
Yeah.
Because that weight is upon that body, and that lumbar aspect of the bone. If you look at the skeleton, that lumbar is just on its own. It's not like the thoracic aspect that had a rib cage, and also it's just the part that is just standing on it. So the weight, anytime such a body bends over, the weight bends on that lumbar, and you want to lift up. So that will also be taken into consideration. Weight losing exercises, and in fact that patient should exercise
very well.
And lastly, any feeling of such pain, symptom of low back pain, see your doctor as soon as possible. Because the earlier you see your doctor, the earlier the progress of or the complication of low back pain is prevented.
Thank you so much, Dr. Ifosa. We cannot thank you enough. We just hope that your program will allow you to come again, come around this city so that you can come to the African Emergency Room and tell us more. Thank you so much. And as you go back, may God Almighty lead you. And I'm sure our viewers have learned a lot from you today. Thank you. Viewers, when we come back, we'll come with a demonstration on how to lift correctly. Thank you and stay tuned.
I'm going to demonstrate how you should lift up a load off the ground. Like in the case of this bag, how we lift up this bag, assumed to contain heavy objects inside, like big books in case of some medical students and other things, and how they should wear this bag on their back without causing them low back pain ultimately. Now, what you do to lift up this heavy load off the ground, the wrong way people lift up this load, you just go and they want to also carry it like this. You know, they bend their back, and they bend their back in lifting up the load, and also wearing it, they are bending their back, and they are fond of carrying it to one side. You see them now bending to one side. But the correct way of lifting up such load is this. You squat, bend your knees, or flex your knees, and squat down to pick the load. Pick the load, then you rise with the load, with the bag. Then if you have to wear it, you can bring it to your level, then you wear the bag on the two shoulders. And that is why it's designed to have two arms or two limbs for you to wear on your shoulder, so you have a balance of your back. Then also make sure that your loads or your bag does not have excess of luggage to prevent the weight on your bag. That will also make it to start bending over. That is the appropriate way in lifting up loads from the ground. Ensure you squat to get the bag, carry the bag, and rise at once. Not bending over to carry like this or bending this way. Rise at once. And if you must wear your bag, wear it on with both limbs correctly. And we are good to go. Thank you.
Yeah, that's one of the many ways you can prevent low back pain. And thank you, Dr. Ifosa, for that demonstration. And thank you for watching today. This is what we try to do in the African Emergency Room, to bring you information about the wrong habits we may have so that we just change. If you have questions, you ask us. You can send us a mail. You can go to our website, watch us on YouTube, watch us on Instagram, say whatever you want to say. Any questions you have, any area we did not capture within this presentation, ask us questions. If you have even corrections to make for us, do that. Let the conversations continue on all our social media platforms. Thank you so much. Keep up with the African Emergency Room. We will come to you again. Goodbye.